it's Tina Frewer here again. I would like to thank you for watching our last video. We covered how to register with IMS and how to save money on your routine medications. So if you didn't get to see that, you can click on the link above and take a look at that, or please watch our next video where we will be giving you additional information. Thank you. So I want to answer two questions that we got asked after our last video. And the first one that came up a couple of times was, is there an age limit to registering with IMS? And no, there isn't. The only thing that could possibly exclude you from the registration would be any pre-existing health conditions, but certainly not your age. The other question that came up a couple of times was, are the savings on routine medications available to you here in Merida in Mexico, or just in the US? And the answer to that is no, they are definitely available to you here in Merida. If you know how to access those savings, they are very real and they are available to you here also. So in the last video, we said that we would cover the subject of what happens if you have an insurance claim and how you manage that. And it is important that you understand the coverage that you have. There are different levels of coverage with your insurance. But that aside, if and when you have a claim, it is important that you're working with a doctor who knows how to submit that claim, who knows the right wording to use, so that your claim is going to be successful. And that really can make all the difference as to whether the insurance company accepts your claim. Usually in an emergency situation, there isn't a question mark over the claim, but if you're planning a surgery and you want to submit the claim ahead of time so that you don't have to pay out of pocket and be reimbursed, then you do need advice on what to put on that submission form, and your doctor can help you with that. I just want to touch on the subject of working with an insurance agent, an insurance broker. And some of you here do, some of you don't. You go directly to the insurance company. But if you're choosing to work with a broker, please remember that the broker is making his money, he earns his income from the premium that he makes on your policy. So it's really, really important that you have a very good relationship with your broker. You know, when the premiums are due, the money goes out of the bank. But the crux of the matter is if you have an insurance claim. And this is not about insuring your car or your home or your fire insurance. This is about your health. And so you need to be confident that if you're working with an agent, the agent you choose is going to be there in your corner, helping you through the paperwork and the system of registering a claim if and when that time arises. Really, really important. I'm going to talk for a few moments about a real case situation, somebody that is known to us. And this person has private health insurance, but when he purchased his health insurance here, he did not disclose two previous conditions, two previous heart conditions. And we know that sometimes people do this. You know, we're always concerned that if we disclose too much information, then either the insurance company will disallow us or they will charge us an incredibly high premium. So this gentleman had two previous conditions, they weren't disclosed, and then it was diagnosed that he needed to have a pacemaker. And so he had huge concerns that the insurance company would not honour the claim. And so by working with one of our doctors, a doctor who is a medical coordinator who works very closely with the insurance companies, the claim was able to be worded in such a way that we felt very confident that the claim would be successful. And so that's exactly what happened. The claim was successful, the patient managed to have the surgery, just paying his deductible, no other out-of-pocket expenses. And had that not been possible, even here in Merida, he would have had to have paid something in the region of $8,000 to $10,000 to have the surgery that was really necessary and vital to his health. So that just really shows you how important it is to be working with the right professionals and to be working with a doctor, stroke medical coordinator who knows how to submit a claim to bring it to a successful conclusion, to help you manage your health or to get you healthy. So this is a real life situation. So we have given you a lot of information in the last 3 videos, and things, really important information, the importance of having a family doctor who can treat 85% of all sicknesses, how you can save money on your routine medications, real savings, 30%, 40% and often 50% plus, and how you can manage an insurance claim, how you can have the peace of mind to know that your insurance claim is going to be successfully accepted, and if there's a surgery that you need to improve your health or to give you good health, then you know that that's going to happen successfully. So we're really excited to tell you that we have put all of these features and many other cost-saving features into a new product that we are about to launch, and we would like you to look out for our next video. That will be coming out to you in an email over the next few days. We are launching a membership product that gives you all of these benefits and many, many others. Lots of free registrations, lots of free services, and real ways that you can manage your health and save you money. So please look out for the email. The product is going to be available in a limited time offer, and we have some very special promotions that will be available to a limited number of people. So we've spent a year putting this together. We're really excited. We know that you need this help, that you can benefit from the services that we have, and so we look forward to you looking at the product that we have to offer and us telling you all of the good things that we have that are very affordable.